Hello everybody, welcome to the topic of lymphomas. It's a very interesting one. Now let's take a look at lymphoma. What is the definition of lymphoma? Let's break the word into two. I'm going to split that word into two. Let's see, lymphoma. Oh, it looks like that's a lymph node, lymphatic. Oma means tumor. So a definition of lymphoma is cancer of the lymph nodes. Do we have lymph nodes in our body? You betcha, right? Lymph nodes are very important. The lymphatic system is what I've drawn on the right side of the body. They're very crucial in draining the interstitial component of the tissues. Remember, from basic physiology, we've got a capillary, right? That's what a capillary will look like. And capillary is where blood flow goes through, right? So blood is going through a capillary system. However, we're going to leak some of the fluid into the interstitial component, and somebody's got to pick it up. The guys that do that job to make sure everything else is returned to our body. A little bit of protein, whatever bacteria, antigen is filtered by the lymphatic system. So their job is to drain, let's say, a little bit of serum in there. If there's proteins, if there's bacteria, they all have to go through the lymphatic system. And that will be a lymphatic vessel, which is now going to drain and end up in a lymph node. So let's take a look at the right side of the board. So this is a typical representation. This is not exactly how it looks like. This is just a schematic representation of typical lymph nodes, right? As you can see, if I cut your body into half, using the diaphragm, there will be above the diaphragm and below the diaphragm. That's very important in this lecture of lymphoma. You can see these lymph nodes in your cervical region, known as cervical lymph nodes, right? So you ever have a sore throat? You feel like your neck is swollen and it's painful? Yeah, those are the lymph nodes that's draining and fighting infections around your cervical lymph node, right? If you have pharyngitis, also, there's supraclavicular lymph nodes above the clavicle, right? There are also axillary lymph nodes right under your axilla, under your armpit, right? If you ever have a sore hand, like a wound, or you have an abscess under your armpit, you feel it's very swollen. Those are the lymph nodes that's draining that area, all right? We have lymph nodes under the diaphragm. We have para-aortic lymph nodes right around the aorta. We have inguinal lymph nodes around the inguinal canal, right? That's draining everything coming up from the feet. So everything that drains up from the feet eventually is going to end up going into your jugular vein using the thoracic duct. And that's eventually how lymph is drained into the heart. It goes through the jugular vein, and the jugular vein is going to end up in your superior vena cava, which is going to now end up into the bloodstream. You get it? So that is a typical overview of the lymphatic system. However, remember, there's all these little nodules I drew here. Those are your lymph nodes. That is a lymph node. Lymph, right, H node. What's inside a lymph node? That's very important that we know that, right? We can't talk about lymphoma without talking about the lymph node. A typical lymph node, right, is going to have a lymphatic vessel, and if you notice, there's a little valve in front of this, inside the lymphatic vessels. Well, the reason it's a one-way valve is to prevent backflow of anything back into the opposite direction. So it's a one-way street. Once you enter it, you can't turn around. If you turn around, cops are going to pull you over and give you a ticket. I'm just kidding. All right? So when cells go through this, right, it's like going through a tunnel. You can't go back, and they end up in the lymph nodes. Now, in the lymph node, you will see the lymph node has a cortex, and also it has B cells, which I put in green, hanging around the cortex. And in the middle, in the germinal center, we have T cells B cells, plasma cells, macrophages. Can you imagine? That's a whole conglomeration of a lot of soldiers. That is the army barracks. That is where all the soldiers live. The reason is they're going to be sampling all the antigens that's coming through your system, and they're going to try to destroy them, either using a T cell if it's a virus, B cell making plasma cells, which is going to make antibodies, or even macrophages to engulf these organisms. So if there's a lot of action going on inside the barracks, it's going to be very hot in there, it's going to be very swollen. That's why you develop lymphadenopathy. And that's why you develop painful lymphadenopathy when you touch under your, right under your mandible, there's submandibular lymph nodes, right? And you feel them or paracervical lymph nodes, and you're like, oh, that hurts. Yeah, that's because there's a lot of action going on inside the lymph node. So now that we know what a lymph node looks like, what the lymphatic system looks like, let's come back to lymphoma. Now when we have a cancer of this lymph node, we have a lymphoma. So there's two types of lymphoma. Let's break it into two. There's Hodgkin's disease and there is non-Hodgkin's lymphoma. That's NHL. And Hodgkin's lymphoma and non-Hodgkin's lymphoma. Well, we're going to focus on Hodgkin's disease in this section of the lecture. So what is Hodgkin's disease? Well, Hodgkin's disease often actually has a certain characteristic. It has a bimodal age distribution. What does that mean? Bi means two, modes means different age. So let's focus on Hodgkin's disease. Hodgkin's disease. When I say we have a bimodal distribution, it means it looks like this. It happens in two different age groups. The first age group is usually between 15 and 30 years old. Very young people. And later in life, patients that are over 50 years of age. That is why it's called a bimodal age distribution. Those are the patients that often get this disease. Now, the lymph node is the bread and butter of Hodgkin's lymphoma. All lymphomas have lymphadenopathy. They are all swollen. So if you don't remember anything, that is very, very common to all lymphomas. So the lymph node histology is actually going to tell us what kind of Hodgkin's disease that you have. That brings us to my story, which I'm going to tell you today. The classic cells that we find in Hodgkin's lymphoma are known as the reed-steinberg cell. The reed-steinberg cell. And they look like this. Ain't that cute? And put little mouths in there. They look like owl eyes. I'm sorry. I'm sorry. Can you let me in? Yeah, those are reed-steinberg cells because they have two nuclei. They look like owl's eyes. If you ever see an owl, they look like that. They look so cute and they look like they're harmless. No, they're not. No, they are not. They're very dangerous. All right? So we're going to follow this owl's eyes cells, also known as reed-steinberg, to differentiate the different types of histological cells that shows off what kind of Hodgkin's disease you actually have. And there is 4 types. But I'm going to start with a beautiful story. So we're going to draw out, there's going to be a party that's going to be going on in a second. So my story begins with, there were 2 reed-steinberg cells that they heard about a party one day. And it was a pool party. So here comes the 2 So here's one reed-steinberg, and here's his friend. They heard about a party that's going on in town. They got the owl eyes, right? And they're like, oh. So they knock on the door, and here's the house. It's a nice, beautiful house. And they heard about a party going on. The party is going on inside the lymph node. It's a pool party. At the back of the house, there's a nice, beautiful pool. Here's the pool with a lot of guys hanging out around the pool. Everybody's sitting around. We've got B cells, which are lymphocytes, right? Hanging around, having a couple on the table, having a good time. So the reed-steinberg cells goes ahead and knocks on the door. They heard about the pool party, and remember, this is the lymphocyte residence. So they knock on the door, and a B cell shows up. It's like, how can I help you? They said, oh, we just walking by. We heard about this nice, good, beautiful party that's going on. Please, can you let us in? We're just going to have a couple of drinks, and we're going to leave. And the B cell said, can I see your tickets? Like, we don't have any tickets. They're like, all right, fine. We're going to let you guys in. That was a bad idea. So they let him in, and this is what happens. So here comes the 2 reed-steinberg cells, right? Sitting down, having a drink. Start talking. They're like, oh, this is a nice party. We forgot to invite our sisters, and our brothers are not here, and everybody's having a good time. They're hanging out. And we got all these other B cells just chilling. They're all having their drinks. These are all the other B cells in the neighborhood. Let's actually make them blue. There's all B cells hanging out in the pool. Some are swimming in the water. They're having a good time. There's the other guys over here. And this is the first histological type we're going to see in Hodgkin's lymphoma. Guess what's going to happen? There's only 2 reed-steinberg, but there's tons of lymphocytes hanging around. They're having a drink, they're partying, dancing, right? Everybody's got to have a good time. So this we call lymphocyte predominant form of Hodgkin's lymphoma. How do you like that? This is actually known as the lymphocyte predominant. Lymphocyte predominant. And this is about 10 to 20% of the time. So the reed-steinberg cell said, let me call my friend, and let me call also my aunt and my brother so they can join the party, right? Since we got in. So guess what happens? These guys, they all band themselves together, right? They came in a big van. The van has a nice, beautiful band around it. So they all came in one shot, right? The reed-steinberg cells goes to the back, and opened the door for the entire family. And guess what we have next? Here's what we had. We've got, this is what happens. This is the pool. And this is the bands, a lot of bands, right, inside around the car, because all the reed-steinberg cells came together, and all of a sudden, there's a lot of reed-steinberg cells in the neighborhood, in the party. Who invited you guys? They're like, oh, you know, we heard about the party, and we decided to stop by, and so the B cells weren't too worried because all of them came in a band. They're like, you know what, you guys can stay in the corner. But as long as you stay within your bands, those bands are known as nodular sclerosis. Nodular sclerosis. So bands of collagen actually envelope the reed-steinberg cells in a pool. So all of them are hanging out in the pool, right? This is the nice, beautiful pool. And this is known as the nodular sclerosis Hodgkin's lymphoma, and this actually bands of collagen. That's how you remember it. Bands of collagen. This happens in women a lot, about 40 to 60% of the time. So, look at the first time they came in, there were few reed-steinberg cells, and there were a lot of lymphocytes, right? But by the time you get to nodular sclerosis, you got all these reed-steinberg cells hanging out in the pool, and they have a band around them. That is the second type, histologic type of Hodgkin's lymphoma. So the third type, all of a sudden, the reed-steinberg cells had to have a good time. They were opening the doors for more of their friends. Apparently, there were a lot of them, and all of a sudden, there were large numbers of reed-steinberg cells in a pleomorphic background. So before we know it, the party looks like this. There's tons of them all around. A lot of reed-steinberg cells. Oh my goodness, where are you guys coming from? Well, we just coming to have a good time, right? And this, we still have some lymphocytes in there. Right? Still like wondering why is there a lot of you coming in? We only want lymphocytes. They're like, well, we're just hanging out. We're not doing a lot. But the problem is this form is known as the mixed cellularity. Large numbers of reed-steinberg cells. So this is the mixed cellularity type of Hodgkin's lymphoma. You follow my party? Good. Started with 2, a bunch of them in the pool, nodular sclerosis, and now we have mixed cellular type, which has lots of reed-steinberg cells in a pleomorphic background. However, guess what this cute little things did? The last stage is now we have lymphocyte depleted. What happened eventually is we're going to go back into the house is this. Yeah, when the entire place was filled with reed-steinberg, there was no, in the entire house is not filled with reed-steinberg cells, and all the lymphocytes were killed one by one. Well, you know what they did? They put a little poison inside the drinks of all the lymphocytes and killed all of them. Thus, we have a lymphocyte depleted. And that happens about 10% of the time. So these guys were bad boys. They lied. They pretended as if they were nice and cute, but all of a sudden they invited all their friends, and by the end of the story, they changed it from a lymphocyte residence to a patient that has developed Hodgkin's lymphoma. It became the Hodgkin's residence, unfortunately. Even this guy got killed in the process, and guess who's laughing now? Ha 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 ha. The reed-steinberg cells. Well, once this apartment becomes filled with reed-steinberg cells and is lymphocyte depleted because there's no more, there's not enough lymphocytes in the house anymore, that has the worst prognosis of Hodgkin's lymphoma. So, how are we going to learn how to stage this disease? We got to learn how to stage it. And the staging we use often based on what you see on physical examination, and you're going to need a CT scan of the chest, the abdomen, and you also want to check the pelvis because that's where all the lymph nodes live. We're also going to need a bone marrow biopsy. And the system we use to actually classify Hodgkin's disease is known as the Ann Arbor staging system. So don't forget, our story started here with just 2 reed-steinberg cells. They came in, but there's lymphocyte predominance. Still a lot of lymphocytes having a good time. By the second time, they've got nodular sclerosing, which is a type of Hodgkin's lymphoma, mixed cellularity, and the worst of the worst when all of them takes over and they're laughing at them and say, "Ha, we took over your house, you suck," right? And that is the histological classification of Hodgkin's lymphoma. Beautiful story. I came up with that. So, using the Ann Arbor system, we are going to stage this disease. And there's only 4 stages. Very, very, very easy. There is stage 1, there is stage 2, stage 3, and stage 4. Usually stage 1 means 1 lymph node. 1 lymph node, stage 1. 1 lymph node, stage 1. So let's pick a lymph node. I'm just going to pick that guy. Look at that. So if I only found 1 lymph node that is very swollen, that is stage 1. 1 lymph node. Very simple. Guess what stage 2 would be? Stage 2 is just 2 or more lymph nodes, but it has to be on the same side of the body. So remember, I'm using the diaphragm to slice our body into 2. So stage 2, you have 2 or more lymph nodes, but it has to be on the same side of the body. So both of them have to be above the diaphragm. So let's say I found 1, 2, and 3, right? That will make it a stage 2 because all of them are above the diaphragm. You got it? Excellent. Stage 3, however, is going to be both sides of the diaphragm are involved. So if lymph nodes were found on CAT scan that were below the diaphragm, above the diaphragm, below the diaphragm, above the diaphragm, that makes it a stage 3. So both sides of the diaphragm, right? That is a stage 3. And stage 4, at that point, everything has disseminated. It doesn't matter which up or down. It's all over the place. It's actually all over the place, and also in extra lymphatic sites. Not just in your lymph nodes anymore. It's not in tissues, in organs, because the cancer has now spread all over. So that's like widespread disease. And that's no dissemination. Widespread past the extra lymphatic sites. And that's how we stage it. Very, very simple, right? 1, 2, 3, right? Up and down, and 4 is all over. So, what does the patient present with clinically? What kind of symptoms do they often have? Well, they often have no symptoms. Huh? Yeah, they're asymptomatic. Often, they might have B symptoms. B symptoms are fever, weight loss, and night sweats. Fever, weight loss, and night sweats. These are known as constitutional symptoms. But that means if you have that with this, you have a very bad prognosis. So that is the symptomatic classification for Hodgkin's lymphoma. So let's talk about the clinical features. What do they present with clinically? Remember I said they have no symptoms. Clinical symptoms. Well, what did I tell you at the beginning of the lecture anything that affects the lymph nodes is swollen. It's known as lymphadenopathy. So the most common symptom is a painless lymphadenopathy. They have no pain. They just like, doc, you know, I have this huge bubble, like just right in my neck, or right. I've been feeling this huge nodule right here, and it's been getting bigger and bigger in the last few weeks. I don't know what it is, but that's the lymph node that's getting swollen, but it doesn't hurt. That's why it's painless lymphadenopathy, because it's a cancer, right? It's a cancer. So often this lymphadenopathy are usually supraclavicular, which means above the clavicle. So when you palpate, you're like, on physical exam, you got some huge nodules around here. Or cervical lymph nodes, when you palpate around the patient's, like the anterior cervical triangle, the posterior cervical triangle, and you start to feel these nodules, huge ones, like, what is that? That might be a lymphoma. And also there's mediastinal lymph nodes that would be in their mediastinum. But you're only going to pick that up with a CAT scan. Also, this can spread from one lymph node to another. So the way it works, it jumps from here to here, jumps from here to the next lymph node, and that's how the disease often progresses, right? Remember, that's what those reed-steinberg cells do, right? They come and knock on your door, you think there's a nice party going on, they take over, they destroy it, and make it a tumor, and then they move on to the next house. And that's how they migrate. Remember, they might have B symptoms or they may not have B symptoms, okay? So if they do have B symptoms of fever, right? B symptoms of fever, weight loss, and night sweats, right? If somebody's complaining of fever, weight loss, or night sweat, and they have painless lymphadenopathy, that is a very, very bad prognosis. And these patients can also have itching and cough. Itching and cough. The fancy name for itching is pruritus and cough. Why do they have cough? Let's take a look. Well, if there's huge lymph nodes inside your mediastinum rubbing over or compressing the trachea, right? The bronchi, like splitting of the bronchi, it's going to irritate the patient's airways, and that's why they're often coughing. That's often due to a mediastinal lymphadenopathy. So how are we going to make the diagnosis of Hodgkin's lymphoma? You know the answer. We got to go to the lymph nodes. You go to where the problem is. So we're going to do a lymph node biopsy. And what are we looking for? If we found these cells inside the reed-steinberg cells, we have made the diagnosis of Hodgkin's lymphoma, reed-steinberg. And basically, this is named after the two guys that found it, like Reed and Steinberg. So if you discover something tomorrow, maybe you can name something after your name. Remember, these are actually cancer cells. No matter how cute they try to look with their little mouths, they're actually cancer cells. They are large cells. They have 2 or more nuclei. I'm only drawing 2 here on the board. And they look like owl's eyes, right? They look like owl's eyes. And this is usually a B cell phenotype. So also, aside from the presence of reed-steinberg, we're going to see inflammatory cells, right? Because when the cancer cells emerges and attacks our lymph nodes, right, which was the house I was describing initially, remember there's T cells, there's B cells, there's plasma cells, there's macrophages at the lymph node. So they try to attack. So we're going to see a lot of inflammatory infiltrate inside your lymph node. And what are we going to see? Well, we're going to see eosinophils, plasma cells, T cells, and B cells. And this is what actually separates Hodgkin's lymphoma from non-Hodgkin's lymphoma. So in Hodgkin's disease, we are going to see a lot of inflammatory cells that I wrote on board. But when you go to non-Hodgkin's disease, there's no inflammatory infiltrate inside a lymph node biopsy. Well, how can I see a lymph node without taking a needle and taking a bite? We can do a chest x-ray or do a CT scan. A CT scan or a chest x-ray. If we don't see anything on chest x-ray, you want to do a CAT scan of the chest, abdomen, pelvis. Chest, abdomen, and pelvis in order to be able to see the swollen lymph nodes inside the body. And we might want to check the bone marrow to make sure the disease has not spread to the bone marrow, because if it has at that point, that is a stage 4. Remember, stage 4 is extra lymph nodal disease, because it's actually moved out of the lymph nodes and migrated to the other part of the body. Lab-wise, on labs, we might see leukocytosis, eosinophilia, and level of ESR is usually high sometimes. So labs might just see a high white count, see a lot of eosinophils, known as eosinophilia, and erythrocyte sedimentation rate is often elevated. And that is just telling you the disease activity is going on, because there's a lot of inflammatory infiltrates going on. If there's inflammation, right, you're going to expect your ESR to be elevated. Now, how do we treat this disease? Well, treatment often is chemotherapy and radiation, right? We want to radiate the lymph nodes to destroy them and prevent them from spreading. So stage 1, 2, and 3A are often treated with radiotherapy alone. And stage 3 and stage 4 will need chemotherapy. So radiation and chemo is the only treatment. And guess what? The good news is chemo and radiation in combination achieve a good cure rate of about 70% of patients that have Hodgkin's disease. So it's actually a curable disease because mostly respond to radiation and chemotherapy. Well, that wraps up the end of Hodgkin's disease. All right, that's all you need to know. It's Dr. Adishina from Feature Teaching Physicians. Till I see you again, have a great day. Bye-bye.